I find it insane, right, how clinicians today typically spend 40% of their time on admin that could be spent with patients instead.
Yeah, I mean, it's not what they studied to do. It's not what they're excited to do. You will never miss an important detail again.
So we gathered here today with some of the key members on the tech team and the medical operations team to plan out the coming year.
And 2026 is the year where we go from being a medical scribe to being a fully fledged medical assistant. It's actually crazy to see that we are helping clinicians in millions of patients' interactions every month.
And also, I mean, working with some of the largest AI deployments in healthcare that has ever been done. For example, in the UK with the NHS, where we're rolling out Tandem to more than 200,000 clinicians, or here in the Nordics, where we're working with Capio and Samtria to roll out Tandem to more than 10,000 clinicians. When we started out, we started with speaking to essentially all of the clinicians that we knew, trying to understand what were the key pain points that they had. The thing that always came out on top was writing medical notes.
Literally every single person we spoke to said, this is my biggest problem. And we were going into a session where we were going to prioritize what to build when we were starting out. And it was just so obvious from the start of that session that one problem was by far the biggest.
And I mean, it feels surreal how clinicians train for decades and then spend 40% of their time on admin that they could spend with patients instead.
Something we've focused a lot on is product simplicity, right? How it works is that when your patient enters the room, you just click start recording in Tandem, and you just leave it on in the background while you're having your patient-doctor interaction. Once the patient leaves, you just click finish and generate notes. In a few seconds, you're going to have your completed medical note ready for you to review. And once you've made whatever edits needed, you can just transfer it with one click into your electronic health record system. After that, you can easily just add whatever codes were relevant, as well as any downstream documents like referrals and sick leave notes. Another big problem for clinicians today is choosing medical codes. So after each consultation, you have to say, what is the specific code that captures the diagnosis, the treatment, and the cause of what happened? And since there often are about 200,000 different codes to choose from, it takes a lot of time. We've now built a solution as well that does the coding for the clinicians. And so we use LLMs in order to generate a set of suggestions for the clinicians to choose from, which rapidly speeds up how long time it takes.
When we introduced Tandem, we sort of broke one workflow that clinicians used to have. Because when you were previously dictating to your secretary, you dictated the note, but you also dictated, these are the 3 additional things that I need your support with. So here also having built the Tandem Secretary module, where you can then send tasks to your secretary directly using Tandem. So you can also ask them to book the follow-up appointments, to put the patient on the waiting list, to send a referral note and similar. Today as a clinician, when you're about to see a new patient, then you get presented these hundreds of medical notes with the entire medical history of that patient, which is impossible to go through.
Yeah, with Tandem's Visit Preparer, you're going to be able to very quickly understand the patient's full medical history and all of the relevant points for the consultation you're about to have.
And so enabling you both to save a lot of time on the preparation for the visits, but then also actually provide better care because you have access to the right data points and the right history.
And we'll make sure that the clinicians have whatever information they need just at their fingertips. They can quickly ask questions about anything that they're concerned about. They can quickly find the source documents for how to examine and how to treat patients with specific conditions and presentations. Typically today you have this long tail of things you need to do after the consultation. Make your prescriptions, we'll send your referrals, book the follow-up appointments, etc., etc.
And here right with Tandem, we're already in the notes writing all of the follow-up tasks in the plan. So it could be that you need to book the follow-up appointment in 2 weeks, or put the patient on a waiting list, or do a prescription, or call the patient in 3 days after the blood samples come back, and so on. So how can we not just write that in the notes, but also help create those tasks and then help carry out all of those tasks?
This means it's going to be a lot easier for you as a care provider to ensure that all of the tasks are actually kept track of and followed up on and completed in the end. So the Tandem Medical Assistant will help you before, during, and after the consultation, really throughout the entire medical process.
And not just saving time, but also being able to provide better quality healthcare. Imagining a future where you as the clinician comes into the clinic in the morning and you barely need to even interact with your computer, and everything just is an autopilot in the background.
Yeah, which I think is most clinicians' dream, to actually just focus on seeing and treating patients, not administration.